Hello and welcome to this Chanelle CPD session. My name is Jonathan Moore. I'm a veterinary surgeon and the Veterinary Technical Services Manager for Chanelle Pharma. Today I shall be talking about coccidiosis in calves and lambs, with a particular focus on our diclazuril product, Dycoxan. This presentation is accredited by both AMTRA and VetPol. For information on claiming CPD points, please contact your Chanelle representative. In this presentation, we shall be covering the following topics. We'll look at what coccidiosis actually is. What is the parasite that causes it? What's the life cycle of that parasite? And what are the effects of this parasite on animals? We'll look at exposure timings before going on to a deep dive on Dycoxan, Chanelle's diclazuril product. We'll look at when to use Dycoxan to really optimize the benefits of this product. We'll finally finish things up with a short quiz at the end to test your knowledge. So what is coccidiosis? Well, it's a disease caused by a single-celled organism, a protozoal organism called Eimeria. On the right-hand side of the screen here, under the magnifying glass, we can see an Eimeria oocyst, and this is part of the parasite's life cycle, which we shall be discussing shortly. It should be noted that protozoal parasites like Eimeria behave slightly different to many other nematode parasites, and this is the reason for employing differing control strategies when managing this parasite. The coccidial parasite causes breakdown of the intestinal lining, preventing the absorption of nutrients and water. Coccidia oocysts are plentiful in the animal's environment and are very difficult to eradicate. They're very resilient. They live for well over a year on pastures or in housing environments, and the parasites multiply very quickly in hosts, meaning that many oocysts are shed into the environment. Every single ruminant in a commercial setting will be exposed to coccidia. In addition, oocysts can travel on dirty boots, on hands, buckets, and even on the feet of birds. The parasite can be considered to be ubiquitous in the environment. There are many different subtypes of Eimeria, and these subtypes are host species specific. Many types of animals have their own subtypes, including birds. Here we can see the pathogenic subtypes associated with cattle and sheep. In cows, we have Eimeria zuerni and Eimeria bovis, and in sheep, we have Eimeria ovinoidalis and Eimeria crandalis. In addition to these subtypes, both cattle and sheep have a number of other subtype species which are considered to be non-pathogenic. And these non-pathogenic subtypes can complicate diagnostic pictures, for example, when looking at oocyst counts in dung samples. It's important to note that subspecies associated with one host species can't affect another species. For example, a cow subtype of Eimeria cannot affect a sheep and vice versa. Even goats have their own subtype, and these can't affect sheep, even though the species are relatively close. It's also a myth that bird coccidiosis can infect other animals. However, as we've said before, it should be noted that birds can transport oocysts from place to place, increasing the likelihood of spreading. Oocysts lie dormant until they encounter moisture and warmth over 12 degrees. Once this happens, the oocysts sporulate and become infectious. Oocysts can be killed by certain types of disinfectant and extremes of heat, but even if these are undertaken, oocysts are very hard to eradicate. And again, this contributes to the situation where we can consider Eimeria oocysts to be ubiquitous in the environment. The final point here is extremely important. Younger animals are at great risk before they develop natural immunity to the parasite. We want to limit exposure to the parasite, but not completely prevent it. We want exposure to happen early in life in order for natural immunity to develop, but we don't want young animals to become impacted and overwhelmed by the parasite. Let's consider the life cycle of the Eimeria parasite. Well, oocysts are shed from the animal via feces and go into the environment. And this can be bedding, pasture, boots, water troughs, anywhere on the ground, for example. These oocysts, once they're in the environment, can remain dormant and in place for long periods of time, years in some cases. But once those oocysts encounter moisture and encounter warmth above 12 degrees, they then sporulate and become activated. And this is the infectious stage. These sporulated oocysts are then consumed by the animal. So they're eaten by the animal and go into the animal's gastrointestinal tract. Here they undergo asexual and sexual stages of reproduction, and finally another generation of oocysts is produced and is shed back out from the animal in the animal's feces, and the cycle continues again. The next few diagrams represent what is happening in the animal at a microscopic level. Let's start by looking at the healthy gut. Here we have a cross-section of gut with blood vessels and cells on either side, the stomach towards the left and the rectum towards the right. And food passes through the lumen of the gut and is absorbed across the villi and microvilli, the gut lining cells, and the nutrients and moisture go into the animal's bloodstream. So this is what's happening in the normal state. Now what happens in the infected animal? So the calf or lamb ingests the sporulated oocyst from infected ground, feces contaminated teats, infected gates, infected anything really, hands of the farmer. And these oocysts go into the gut, and here sporozoites emerge from the oocyst and invade the gut lining cells. The coccidial parasites now undergo asexual reproduction, multiplication. And this multiplication is rapid and to a great extent. So it's up to 2 million-fold increase in the space of just a week. The cells, the gut lining cells, burst once the number of parasites within them becomes too great, and parasites are then free to infect adjacent cells. Further stages of asexual multiplication occur, and as the parasite numbers increase further, more and more gut cells are destroyed. Finally, the parasite undergoes a stage of sexual reproduction, and new oocysts are produced and shed in the animal's feces. The time from ingestion to the production of oocysts is around about 18 to 24 days, 21 days on average, depending on the species, and this time is what's called the pre-patent period. A single oocyst can be responsible for the destruction of up to 50 million gut lining cells. So you can see even a small infection can cause massive damage. And in situations where animals ingest a huge number of oocysts, we can really easily see that the damage to an animal's gut lining can be severe. And this is what goes on to cause clinical coccidiosis. So here we can see two post-mortem examinations from animals that have died as a result of clinical coccidiosis. In the first picture, we can see hemorrhagic lesions on the gut wall. The gut has been opened here to see into the lumen, and these small areas of petechiation, as they call it, are highlighted by the dotted yellow line. In the second picture, again, we have a section of gut that's been opened, and here we can see blood clots and sloughing of the gut lining into the lumen of the gut. This blood and slough material is passed out in feces in the live animal and can be seen as a bloody scour. And this is a common symptom of clinical acute coccidiosis. So talking of symptoms, let's go on to consider all of the symptoms associated with clinical coccidiosis. I'll give you a moment to consider how many you can think of. So, the clinical symptoms of coccidiosis. The pictures here give away the first of these, which we've already discussed, and that is scouring, which is often black or bloody. Next, the animals often display tail swishing. This is because of discomfort. They are often straining to pass feces. There is fluid loss from the animals. That's because the animals cannot absorb fluid across their damaged gut lining. They are also often anemic because of this blood loss. They're often lethargic, and this is because they're not absorbing the nutrients they need to remain active, normally active and alert. They have a lack of appetite because they just don't feel very well and don't feel like eating. Fever can be present, and this might be associated with secondary infections. Finally, death can occur in the most severe of cases, and this is more common in sheep. I consider this slide to be one of the most important in the presentation. Cases of clinical coccidiosis with the symptoms we have just looked at represent only 4% of infections. 96% of coccidiosis infections are subclinical and don't show any clinical signs. Animals with subclinical coccidiosis will not perform as well, and growth rates, food conversion rates, and times to reach key milestones will all be impacted. Having spoken to many farmers about this issue, it seems like this point is not widely understood. Coccidiosis is both an economic and clinical disease. However, many people only think about it as a clinical disease, and this is understandable. It's what's visible when farmers are looking at animals. People might not consider that a seemingly healthy animal is being affected and impacted by coccidiosis, and will be missing out on optimizing that animal's health and performance. So we know that in order to see coccidiosis, we need both oocysts, obviously, and we also need younger animals without an established immunity to the parasite. However, the situation is compounded by poor hygiene and stress. Poor hygiene increases the environmental contamination, and therefore the infection pressures on the animals are greater. Stress has an impact on the body's ability to mount an immune response. This will increase the impact of coccidiosis and slow down the development of natural immunity. When will animals be exposed to coccidia? Well, the situation is slightly different for calves and lambs. In calves, exposure typically occurs around 4 to 17 weeks of age, and it often coincides with moving to a new environment. When animals move to a new environment, this often represents a stressful period for the animal, and as we've seen on the previous slide, stress can really contribute to this problem. In lambs, exposure is a little more clearly defined and happens at around 4 to 7 weeks of age. This coincides with the waning of immunity derived from ewes, which happens at around 3 weeks of age. This immunity is derived from the ewe's colostrum. So controlling coccidiosis requires a combination both of environmental management and coccidiosis treatment and/or prevention. Both are required, and the "and" symbol here is really, really important. This differs from the situation with nematode infections, where resistance to certain classes of antihelminthics is becoming an increasing problem, and proof of disease is recommended before selecting an appropriate worming product. Let's have a closer look now at Dycoxan. That's Chanelle's diclazoral product. Well, the active, as we said, in Dycoxan is diclazoral at 0.25%, and it's effective against sexual and asexual stages of the parasitic life cycle. The life cycle is broken for 2 to 3 weeks. The product can be used in both lambs and calves, and it's an oral suspension for the prevention of clinical signs of coccidiosis and the reduction of oocyst shedding. There's a 0-day meat withdrawal and several pack sizes, a 1 litre, 2.5 litre and a 5 litre. It's a POM VPS product. Finally, in terms of dosage, it's the same for both calves and lambs, 1 mg per kg or 4 mils per 10 kilograms given orally via a drenching gun. One of the really, really important points to note is that no resistance has been reported to diclazoral at the current time. This lack of resistance is really important and is part of the reason we can be comfortable with preventative treatment. So how does Dycoxan work in the animal? Well, Dycoxan disrupts the parasite's development at both the asexual and sexual stages of the life cycle. When we treat animals during this development phase, we halt the life cycle of that generation of cocci. And we provide the animal a window of protection and give the animal a chance to build up their own natural immunity to the parasite as exposure continues. Remember that we want animals to pick up the parasite and be exposed, but we don't want them to become overwhelmed. And dicoxin is very helpful in achieving this. So dicoxin protects the animal for a period, but allows time for it to build up its own natural immunity. Diclazuril has a half-life of 30 hours, and this contrasts with another anticoccidial active, toltrazuril. This has a half-life of 9 days, and this might seem like a benefit. However, a longer half-life blinds the animal's immune system to the coccidia during this time and slows the development of natural immunity. Clinical evidence suggests that animals' performance and growth at 80 days is poorer after treatment with toltrazuril when compared to diclazuril. What about treatment timings? Well, this depends on when exposure occurs, the management approach taken, and the severity of exposure. Broadly speaking, there are 3 options. The first is prophylactic treatment. Prophylactic treatment tends to be employed when coccidiosis is seen on a farm at specific and repeated times in the year. If this is known and this is happening on a farm, then treatment can be given 1 week before the problems are expected to appear. This situation is less likely today because of the varying weather conditions that we're seeing as a result of climate change. And this brings most people onto a situation where they are considering metaphylactic treatment. So here, treatment is given at specific times depending on the known exposure times. So for calves, treatments tend to be given 14 days after the animal has entered a risk environment. It may be after that animal has gone through the movement or the move that we discussed earlier. In lambs, it's a little more simple. Treatment can be given at 4 to 6 weeks of age, because we know this tends to be when coccidiosis is seen in this species. Finally, there is therapeutic treatment, and this is where a dose is only given to clinically affected animals. As we've discussed previously, because of the massive impact of subclinical coccidiosis, this might not be the most appropriate choice of treatment. It should be noted that due to dicoxin's shorter residual activity, a second treatment may be required after 21 days, and this would be in situations where there has been extreme exposure or ongoing clinical issues. Now, this situation differs from that we see with nematode treatment. Here, resistance to certain classes of anthelmintic is becoming an increasing problem. In these situations, prophylactic and metaphylactic use is discouraged to help slow the development of resistance. In these circumstances, it is recommended that testing be carried out to demonstrate a need for treatment before that treatment is given. However, with coccidiosis, the situation is different. Infection is guaranteed. All animals will come into contact with coccidiosis. Infection is inevitable. And this is because the oocysts are ubiquitous in the environment, as we've discussed previously. What we need to do with coccidiosis management is ensure that exposure is controlled and kept at a level not to impact the animals either clinically or subclinically, and to allow natural immunity to develop. And this is really where dicoxin comes into its own. Can we quantify the financial benefit of coccidiosis treatment? Well, several studies have been undertaken to demonstrate this, and the figures on this page are an estimation based on combined data from several studies, using prices at the time of publication. So studies have shown that anticoccidial treatment can lead to a 19% group performance lift on average. And this really is an equivalent to an extra calf in terms of body weight in a group at 42 days. So a clear benefit there. Each infected animal can cost the farmer up to £60. So we can see that costs of coccidiosis will mount up very quickly, and these will rapidly outweigh any cost of treatment. In addition, treatment with anticoccidials in early life leads to increased conception rates and decreased age at first service for replacement animals, but it also causes decreased general clinical disease, a decrease in food conversion ratios, and an increase in animal welfare. But what about diagnostics? We are used to actioning the results of fecal worm egg counts with regards to nematode infections, but what about fecal oocyst counts? Results of this test should be interpreted with caution for a number of reasons. Oocyst numbers may be irrelevant. Almost all fecal samples will contain oocysts, and even adult animals will shed oocysts, despite having immunity. Immunity can be described as being non-sterile, and this makes oocyst numbers in dung samples very hard to interpret. In addition, non-pathogenic species may also be present, and this may complicate the picture. Ideally, speciation of oocysts is required, but this isn't always available. In severe disease, oocysts may not even be present in feces. If the disease is severe, we might see clinical signs before the parasite has had a chance to go through its life cycle to the point where it can produce new oocysts. Finally, other diseases can also cause scouring and can complicate the picture. For example, nematodirus in lambs often occurs at the same time as when we see clinical coccidiosis. Diagnostic testing might still be useful as a piece of the puzzle in the overall larger picture, but results have to be interpreted with caution. What else can we advise in terms of environmental management? Remember, environmental management is an important part of the story. Here are a few more important points to consider. Number one, animals should be fed outside of the pens so fecal contamination of food does not occur. At two, we can see the importance of biosecurity. Foot dips, very useful, as well as having different overalls or different boots for different groups of animals. Hand washing, also incredibly important when moving between different groups of animals. At three, we have a creep feeder, and this is really highlighting the importance of moving creep feeders and water troughs to reduce environmental contamination around these high traffic areas. At four, disinfectants are incredibly important. The disinfectant has to be licensed to kill coccidia. Even when using disinfectants, we still have oocysts present in the environment. As we said before, they're very, very difficult to eradicate, but using disinfectants can reduce the environmental contamination and infection pressure. Five, isolation pens for sick animals, really important to be away from healthy animals so you don't get cross-contamination. And at six, when considering feeding tubes, don't just have one feeding tube on the farm. At the very least, you should have one tube for sick animals and one tube for healthy animals, if not more tubes. Finally, deep bedding and good bedding is really important so animals are not constantly coming into contact with their own feces. This brings me to the end of the presentation. So here's a little self-assessment quiz for you to test your new knowledge. I'll read through the statements and see if you can fill in the blanks as we go. Something and something conditions cause oocysts to activate and sporulate. Dycoxin allows animals to develop. Anticoccidial treatment equals something group performance lift on average. Treat something, not just symptomatic animals. Both something and the use of something are important to reduce the impact of coccidiosis. How do you think you've done? Let's find out. Well, wet and warm conditions cause oocysts to become active and sporulate. Dycoxin allows animals to develop natural immunity. Anticoccidial treatment leads to a 19% group performance lift on average. Treat the whole group, not just symptomatic animals. Both environmental management and the use of anticoccidials are important to reduce the impact of coccidiosis. Hopefully you got the answers to those questions. Here is a list of references that we used to create this presentation. Finally, we hope this presentation has been useful. Thank you so much for your time. please feel free to reach out to your Chanelle representative for further information. In addition, have you logged on to Chanelle's website? You can use the QR code here to scan you onto it. Here you will find further information on coccidiosis, as well as information on other diseases and Chanelle products. We look forward to seeing you on another Chanelle CPD session in the near future.